Okay, hello everybody. We're supposed to have a staff meeting to let you know about the COVID-19. We activated our emergency operation plan yesterday. Even though Lisa is sick, and if everyone's wondering where's Lisa, we quarantined Lisa because she came in from Italy, and so we put her on self-quarantine. But all the managers have met, and we have implemented our COVID-19 plan, emergency plan. So what does this mean? So we're going to start with a couple things. Prevention. So we've done training, COVID training, and all of you who haven't done it, please let us know because we need you to go through the training. There are some specific things for healthcare providers and specific for home care, which is going to probably be covered in this video. Those of you who haven't got fit tested, that's another prevention measure, and I'm going to talk to you about the N95 mask in just a minute. But I want you to get your fit testing because this is a measure that we want to do. And then we want to educate you and we want to educate the staff. So our goal with the COVID-19 are three things. We want to reduce the exposure, and we want to limit the spread, and we want to continue to provide patient care. So that's why the training is so important. The N95 fit testing is so important, and we want to educate everybody on the COVID-19. We are working on a flyer right now that we want you to give all your patients. The flyer is going to cover three things. It's going to cover the screening. It's going to cover what are we going to do if any of those symptoms occur for patient, family, or us. And it's going to cover some pictures of hand washing and stay at home and how to sneeze. So those are really key things. Okay, so preparation, that's prevention. Surveillance, there's only two things we're asking of everybody starting today. You should have done it. Every time you call your patient and you're going to confirm the visit, we're going to ask you to add 2 questions to your confirmation. We're going to ask that you ask them question number 1, have you traveled in the last 14 days outside of Guam? You or your family? It's a yes or no question. The second question is, in the past 14 days, have you or any person you live with been in close contacts with someone with these symptoms? Cough, fever, runny nose, sore throat, shortness of breath. And if they answered yes to question number 1 or yes to question number 2, for sure question number 2, we're going to ask that you don't go to that home, but you got to let us know because we got to call and get the order from the physician. We have a fax form. We will have it available because when you come in, we're going to have you fill out that fax form because that's a form that we're going to send out to the doc. Okay, so that's the surveillance. If you are out sick from these 2 questions, you have to report directly to HR. You can't come see me, or you can't go to see patients. You got to go to HR, fill out the questionnaire, and you got to get cleared by your primary care provider. We need to make sure we reduce exposure and spread. Okay, now comes to patient care. So what do we do and how do we do it? So the case managers, and I'm going to say who they are. It's Lakeisha for team 1. For team 2, it's Hazel. For team 3, it's Isabel. Are going through all the patients this weekend, and they're going to color code the patients like we do in Typhoon. Green, stable patients. If we need to see them, we'll see them. Not, we're going to cancel the visit. Yellow, those are patients that PT is on or patients that need some help. And red, they will then give you your guidance on what you need to do should we do that, okay? So business as usual on Monday, but you just need to know if the case managers tell you on Monday, if somebody calls out sick because of these symptoms, we're going to be telling you what to do. So the emergency operation plan is for the whole agency, but it's probably going to be team related because one team might be out and then the rest of us have to step in and help them out. So this is how we do it in COVID-19. We're also going to evaluate why is the team out. So if I'm in the South and I'm out sick and all my patients are sick, we're not sending you down to see our patients. We're going to keep you away from them. Okay, so here's our problem. Supplies are our problem right now. So everyday practice, you all need gloves. Everyday practice, you all need hand sanitizer. And everyday practice, you need wipes. You need a mask in case, and I'll talk about the mask in a minute. And your PPE are the two last areas. So let's talk about gloves. Just so you guys get an idea, we go through 72 boxes of gloves in a month. This week is the week that we get the new set of gloves, okay, for next month, and it comes in this week. We haven't gotten them. We have been told by all our local vendors and all our off-island vendors they're not in stock and there's a delay. So what do? Immediately effective today, we are limiting issuance of gloves. So who gets the gloves? It's definitely going to be the nurses' aides. They get the priority because they have to give baths and they have to touch patients and all their body parts. Okay, so they're going to get the gloves, and we're going to really monitor that. We're going to monitor if you're scheduled to see 30 patients in a week, that's one pair of glove for 30 patients. That's 60 gloves in a week. So we're really going to be really tight on the gloves, okay? Nurses, we're going to give you gloves, but we're going to have to identify of your visits, who are you going to be touching to do care, like wound care, Foley, those kind of things. You're going to end up using your gloves, so we're going to count that. I'm telling you, we're really stressed about this. The gloves is a big issue. Rehab team, I am sorry, you are not going to get gloves, and social work, you're not going to get gloves. Okay, so and that's a big crisis. One of the PTs brought up MRSA, and I said, you're still not going to get gloves because you're not handling any blood or bodily fluids. And if there's a skin rash or something, don't touch them. Okay, that's all I'm going to say. You are going to be provided soap and water, paper towels and soap. And if we are out of liquid soap, you're going to be handed a bar soap. And if you did not watch the CDC videos this morning that I sent you, watch them, because that's what's important on this infection control measures. Wipes out. Okay, and we are just freaking out about that as well. So there is one thing coming right off the CDC website on making our own wipes for cleaning our blood pressure cuffs. We're pulling all the wipes off the clinic and we're going to use them, and clinic has to do this. So here's a spray bottle, and on the spray bottle it's going to be measurements. Okay, so CDC website says 1 quart, 4 teaspoons of bleach to 1 quart of water. That's what the site says. So 4 teaspoons of this, and I'm going to have to figure out how many mLs is that in terms of syringe. And you're going to squirt it into this, and you're going to just fill it up with water. Okay, and this is what you're going to use to clean your blood pressure cuffs or wipe down your equipment. If we really are in trouble here, we are thinking of paper towel. Well, that's coming to an end too for us because there's nothing available. We're also thinking of getting wipes, baby wipes. They're not, they don't kill germs, but if we mix this solution and pour it into the baby wipes, now we've got the 99% killing the bacteria and the viruses. Okay, so that's the wipes. When it comes to masks, no masks are going to be given out. Let's just start with that. So somebody came to me and said they need a new N95 mask, and I said, nope, you're not going to get it because they already used your mask. The mask that you were given at when you did the fit testing was so that in the event we do put you into a COVID-19 case or an active TB case, you are to wear your mask, and we'll tell you that, okay? That's coming from public health to us. We have one patient that we suspect TB, and there's only one nurse going in there, and that one nurse or that nurses that are going in there have been issued out the N95 mask. We've already planned that out, okay? So if you've used your N95 mask, great, you're not going to get another one, okay? But you do know how to use it, so that's the beauty of it all. When are you going to use an N95 is, again, when public health comes to us and says, HSP, we want you to take care of this home isolation COVID-19 patient. Great, we're going to take care of them. We're going to issue full PPE with the N95 for each time you're in there. And here's the rule for COVID-19 cases. You're only going to go in once a week. We're not going to allow you to go in more than that, okay? And so if we do this, we are going to come up with a protocol on that. Face masks, regular surgical masks. When can you use those? Never. Okay? I mean, really never. There's just nothing available. So we really got to control the usage of that. So I've had staff come to me and say, patient's coughing when I'm shaving. Well, don't shave. Let them grow a beard. It's pretty much what I'm going to tell you. It sounds terrible, but at this time, we can't do that. So things change in how we deliver our care. It's just how it is right now. It is tough. I'm really sorry about this, but here's the thing. I want to make sure that we continue to provide care. I want to make sure that we can continue to get you guys to work. And so that you guys can continue to have a job and get paid. That's key for me, okay? Now, we also anticipate changes in the work design. School's going to be out, and parents, you're going to have to stay home with your kids, so you're going to have to redesign your work schedule. I'm going to have the office open till 9 p.m., and you can go out and see your patients from 5 p.m. to 9 p.m., okay? We're going to be having to redesign our schedule so we can accommodate you guys, and you guys can work on a schedule at home on who's going to watch the children or your family situation, so we can continue to do our work. I don't think there's anything else. All I'm going to tell you is I'm going to keep posting CDC videos so that you are to watch it. I really want you to watch it because it's really important that you watch it. Please pay attention to the case managers. They will post things up to your team as things progress. We ask that you practice safe practice at home. Wash your hands, wash your hands, wash your hands. Watch the videos because those videos are good. A good example I'm going to tell you is Taiwan is right next door to China. And why is it that they don't have a very big COVID-19 reporting? Is because they came out mass prevention, mass education. Wash your hands, wash your hands, wash your hands. The government issued everyone one mask. And I think that's what they think has happened, is their risk went down because of the hand washing, and I totally agree. Okay, so one of the videos talks about you do this and you do this and then it's all over, and so that's an important piece. So that's it for this meeting, and any other questions, post it on the Tiger Text, and if I can't answer it, I will bring it back up to Dr. Alves. And it's going to be really dicey when we're doing that screening for patients. How do we do it? And I honestly don't know, so we're going to have to ask Dr. Alves those questions. Okay? Everyone have a good weekend. Talk to you later. Bye.